Introduction. Single Anastomosis Duodeno ileal bypass with Sleeve Gastrectomy SADI S is a novel bariatric or weight loss surgery for patients with morbid obesity. The surgery is based on the principles of biliopancreatic diversion, in which a sleeve gastrectomy is followed by an end-to-side duodeno ileal anastomosis. The preservation of the pylorus, the opening from the stomach into the duodenum, and proximal duodenum allows for reconstruction in one loop, which decreases surgical time and requires no mesentery opening. SADI S is a modified duodenal switch surgery that uses a single anastomosis rather than two and involves restrictive and hypoabsorptive techniques. The restrictive part of the procedure involves creating a vertical gastric sleeve by removing about 80% of the stomach. The hypoabsorptive part of the procedure reroutes a lengthy section of the small intestine, creating one common channel and two separate pathways. The smaller of the two pathways, the digestive loop, also called common channel, carries food from the stomach to the distal bowel. The much longer pathway, the biliopancreatic loop, takes bile from the liver to the common channel. This diversion restricts the length of time that food mixes with digestive juices and decreases the portion of calories that a patient's body absorbs, leading to increased weight loss. Disease overview. Obesity is a chronic condition in which there is an excessive accumulation of fat in the body. Obesity is defined as a body mass index, BMI, of 30 to 34.9. And morbid obesity is defined by a BMI of 40 or more. Obesity is a global problem affecting people of almost all age groups and is associated with a greatly increased risk of cardiac problems, diabetes, high blood pressure, breathing difficulties, and diseases such as cancer. Indications. SADI S surgery may be recommended when diet, exercise, or medications have not helped in reducing your weight. It is indicated for people with a BMI of 40 or more, severe obesity, and who are suffering from obesity-associated health conditions such as type 2 diabetes, heart disease, high blood pressure, high cholesterol, sleep apnea, non-alcoholic fatty liver disease. Preparation. Preoperative preparation for SADI S may involve the following: a special diet for 2 weeks until the day of surgery, a thorough history, physical examination, and some endoscopy and radiology exams, routine blood work and imaging, refraining from blood thinners, aspirin, or NSAIDs, informing your doctor of any allergies to medications, anesthesia, or latex, refraining from solids or liquids at least 8 hours prior to surgery, signing a consent form after the risks and benefits of the surgery have been explained. Procedure. SADI S is mostly performed by laparoscopic technique under general anesthesia and is a 2-step procedure. The laparoscopic method is performed through 4 to 5 small incisions. A laparoscope, a thin fiber optic tube with a light and camera attached to its end, is inserted through one incision. The camera allows your surgeon to clearly view the operating site on a monitor. Surgical instruments are inserted through the other incisions to perform the procedure. Step 1. Your surgeon will perform a sleeve gastrectomy, eliminating approximately 80% of the stomach, leaving a banana-shaped stomach 1/4 of its original capacity that remains connected to the duodenum. Step 2. Your surgeon will now perform an end-to-side duodeno ileal anastomosis in which the intestine will be detached just below the stomach, duodenum, and then reattached to a loop of intestine, ileum, around 2 to 3 meters downstream. The duodenum is the first part of the small intestine, and the ileum is the last part. An anastomosis is the surgical connection between two structures. The food bypasses the duodenum, the first 2 segments of the small intestine, and the jejunum, significantly decreasing absorption of nutrients, which helps with weight loss. The objective of the two-step procedure is to successfully divert food from the metabolically active section of the intestine and reduce the total length of the intestinal loop in which nutrients are absorbed. Post-operative care. Your doctor will prescribe pain-relieving medications to keep you comfortable. You will be given instructions to follow regarding wound care, diet, and activity, such as: keep the incision area clean and dry. Avoid strenuous exercises and lifting heavy weights. For the first month after the procedure, eat only small amounts of soft foods. Sip water throughout the day to prevent dehydration. Follow the diet regimen given to you by the dietitian. You will require diet counseling and daily vitamin and mineral supplementation for life. Advantages. Some of the significant benefits of SADI S when compared with traditional bariatric surgeries such as gastric bypass or gastric sleeve include: facilitates greater weight loss, enables a much more powerful and effective control of associated metabolic comorbidities, type 2 diabetes, hypertension, sleep apnea, can be performed on individuals who have already had a sleeve gastrectomy and are unhappy with the results, reduces the risk of nutritional deficiencies or diarrhea that is commonly seen in traditional Roux-en-Y duodenal switch surgeries, minimal risk of intestinal obstruction, reduces the likelihood of certain problems such as blood sugar fluctuations, food intolerance and restrictions, marginal ulcers, and dumping syndrome. Disadvantages. The disadvantages are similar to other bariatric or metabolic procedures and not exclusive to SADI S, and can include infection, abscess, anastomotic leaks, chances of bile reflux, increased risk of pulmonary embolism and venous thrombosis. Summary. SADI S surgery provides greater weight loss than a standard sleeve gastrectomy or gastric bypass without increased complications. It uses a combination of restrictive and hypoabsorptive techniques to achieve a successful outcome. The procedure reduces appetite, restricts food portions, and triggers hormonal changes that produce a positive effect on your metabolism. The goal of the surgery is to make you feel full sooner so you do not overeat and absorb fewer calories by the modifications made in the small intestine.